Hello, my name is Katie Schubert, and I am a registered nurse practicing in the critical care environment in San Diego, California. It's come to my attention in my almost decade-long career that anxiety, depression, burnout syndrome, and even PTSD are real issues in our healthcare environment today. Especially in the wake of COVID-19, I've seen an increase in all of these issues in my coworkers and even battled some anxiety and stress myself. And that brings me to my proposal topic today, titled Pre-Shift Peace, Helping Nurses Find Their Zen with Yin. One of the ways that I've personally been able to find peace during this really challenging time in healthcare and even pre-COVID is through mindful movement, meditation, and really any type of exercise. But I found that a mindful practice of yin yoga, even for just 10 to 15 minutes a day, has been incredibly beneficial. And the research actually supports this personal finding of my own. So, burnout among registered nurses is very prevalent, it's very timely. There have been studied interventions to mitigate the stress and emotional exhaustion that nurses experience, and that does include yoga and mindful movement. I'd like to propose yin yoga as a way of assisting nurses in grounding and getting centered before they start their shift. Yoga is proven in the research to lower anxiety, and by incorporating a yin practice into their day prior to their shift, nurses could walk into work feeling calm and ready to tackle whatever comes their way. So that's what this presentation will discuss, will be the benefits of a very short yin yoga practice prior to a nurse's shift, and hopefully integrate some calm and peace into their day as they care for others. So the learning objectives of this proposal would be to evaluate the data regarding registered nurses, burnout syndrome, moral distress, and even PTSD, especially in the wake of the COVID-19 pandemic. I'd like to discuss the data that we're seeing now versus pre-COVID, and how pressing this issue is now more than ever, that we help nurses learn how to mitigate their stress and protect their mental health. I'd like to identify some successful outcomes in the research methods that have been studied to reduce burnout syndrome among registered nurses and other healthcare providers. There have been some successful interventions, and I'd like to bring those to light. I'd also like to describe and even present this short yin yoga program that I've designed for nurses. They can easily access this from home before their shift starts. I'll even include some data about incorporating yoga and mindful movement in the actual workplace and how that can be beneficial to healthcare professionals as well. My target audience is nurses, hospital administrators, nursing managers, physicians, respiratory therapists, anyone that's providing direct patient care is my target audience. And I'd like to talk about the loss of burnout syndrome and why it's important to mitigate this issue. It's a cost to both nurse and hospital, so I'd like to discuss why this is such a pressing issue, especially when it comes to affecting the people that we care for. So I find that to be a big red flag. It comes down the chain, and we have to protect our nurses and other healthcare providers' mental health in order for our patients to have good outcomes, which is the end goal of healthcare. I'll end my session by having everyone walk through work through a short yin practice, some breathing, and some guided positive affirmations. So thank you so much for your time. Have a beautiful day, and happy yin yogaing.